first of all, would you agree that we should start at basic mechanics? Is there something else you think, oh, we'll start somewhere else? And then also, if we are going to start at basic mechanics and try to understand that stuff, like how does someone start to understand that stuff? Now, obviously, this is just a spoken word, or somewhat visual if you're watching it on YouTube. So we're not going to be able to be like, here's all of the anatomy chart, blah blah blah. So this is somewhat theoretical. But how can someone start thinking about that stuff?
So firstly, when you're thinking about anatomy, you have to think of it in terms of the different levels. So the discussion of like cytology and histology wouldn't have much relevance here as it applies to exercise. But at the same time, there's actually a couple of things that would be relevant within cytology and histology. So the study of what's going on at the level of the tissue and what's going on at the level of the cells. Because when we talk about muscle, which is effectively what we would be talking about most of the time when we're discussing anatomy in the context of exercise, we actually have to start at that micro level, where at the micro anatomical level, what's going on effectively is that you've got overlapping layers of proteins within your muscle cells, actin and myosin primarily, but many other proteins such as titin and desmin and many others that are involved in muscle contraction. And these are the proteins that you're effectively trying to put tension on in order to get certain adaptations, whether they be increases in muscle size or increase in muscle strength or force production, etc. Okay, so you can see Paddy's book there. He's got the various layers of what's going on in the level of the sarcomere. And if you're a member of the Coach's Corner, you'll have heard me discuss this in great detail. So effectively, within the muscle,
this is literally, again, you don't need to know a huge amount about this stuff. Very basic stuff. Like this is literally like anatomy essentials from like that For Dummies series. I'm talking like this is just basic stuff. You don't need to go into like, even like Gary's talking about there. It's like, oh, you need to know the actual, like, we'll call it biochemistry down to the very specific levels. Like this stuff is really helpful, but it's not like you have to be an expert at this stuff just to work out. Sorry for interrupting.
Not at all. Like the fundamental principle that you need to extract from the microanatomy, at least, is that the proteins in there are going to respond to tension. That's fundamentally what you need to understand. Also understanding, I suppose, that at that microanatomical level, there are many other things within your muscles, such as energy stores. People always talk about muscle glycogen. There's also going to be fluid within there. There's going to be various meshes involved in the supply of energy, like calcium channels and mitochondria, etc. All of these things are involved in the provision of energy during exercise, and then also the adaptations that we get from exercise. So there's some relevant things to extract there, but fundamentally, the main thing is that muscle is an active tissue. It uses energy. Some of the adaptations respond to the use of that energy, and then also it's responding to tension that's placed on it, okay? That's about as much as you need to extract from the micro level. As we zoom out and move to the more macro anatomical level, I suppose one kind of prerequisite for understanding the role of muscle and thus the subsequent adaptations is to first look at the level of the joint. So when we talk about joints, we're typically talking about the articulation or two bones coming together. You can think of it as, it's not always two bones, but often we're talking about two bones coming together and moving on each other. They could be, hinging, they could be pivoting, they could be rotating, etc. Okay, there's many different types of joint movements, and the movement that's available at a given joint depends on how it's structured. So, for example, the elbow would be considered to be a hinge joint, whereas your shoulder and hip would be a ball and socket joint, and then your ball and socket joints, and then your knee would be a hinge joint as well, with some rotation in there, but primarily a hinge joint. So that may not seem like it's particularly important, but it does become important when understanding exercise, because Patty mentioned previously the example of, for example, rotating the feet in and out on a squat to target different portions of the quads. But if you can understand that the knee is primarily a hinge joint, then you recognize that moving in that plane, changing the position of your feet doesn't really modify what's going on in the quads, because they're primarily acting on flexion and extension, and thus they're not going to be responding too much to rotation or changes in hip adduction or abduction. Now, that doesn't mean there's no effect, but just extracting that basic anatomical knowledge, you can get an idea of what's going on. Additionally, if you understand that the shoulder, let's say, is a ball and socket joint, you can appreciate that you could train the same muscles in many different planes. So, for example, if you lift your arm out in front of you, you're working your anterior and middle delts. If you lift it out to the side, you're still also working your anterior and middle delts. And for those watching, if you take your arm from the front, with my hand facing inward, and I go back like that, like a reverse pec deck or a reverse rear delt fly, again, that can be working the middle delts. So they're all different types of movements, but because it's a ball and socket joint and we know that there's rotation there, we know that we're able to challenge those muscles and that they don't just do one thing. Whereas when it comes to the bicep at a hinge joint, like Paddy mentioned previously, if you're doing loads of different curls, you're kind of just repeating the same movement, and that muscle is just going to be trained consistently through elbow flexion. So that's just a very basic overview of the joints. The relevance of that really becomes more important when you look at, mechanical factors like range of motion at different joints and injury mechanisms, etc. Okay. Now, muscles, when it comes to anatomy, obviously I'm not going to walk through all the different muscles in the body because that would just be absurd. But if you understand where a muscle originates and where it inserts, so it's proximal and distal attachments, basically the 2 points at which, if you were to think of it as a string that it pulls from or shortens from, that can tell you a lot about its function and thus a lot about how you might exercise to get adaptations in that muscle. Because if you were to think of, let's say, the biceps, again, just being a really easy one, if you've got an attachment above the elbow and you've got an attachment below the elbow and you shorten what's in between, you can appreciate that elbow flexion is going to result from that. Similarly, if you look at the pecs, they're probably the best example to illustrate this. You've actually got a muscle that is originating all along your sternum. Okay, so it's got a big, broad origin. Also your clavicle and some other places down near the obliques and aponeurosis, etc. But you've only got a small little insertion on the upper arm. Okay, you can see this if you're watching the video, you'll see it in Paddy's textbook. You can see the broad origin from the middle or medial part of the clavicle all the way down the sternum and then down onto the costal cartilages of the ribs and the oblique aponeurosis. You'll see that's really broad, but then we've got a narrow insertion there by the intertubercular groove on the upper aspect of the humerus. So that's the upper arm or arm bone. And what that actually means is that the upper pec can have a different function to the lower pec, because if you look at the direction that the fibers pull and you think about the connection between the origin and the insertion, you can begin to appreciate that the upper pec is going to lead to a bit more shoulder flexion along with horizontal adduction, whereas the lower pec would lead to more extension, but that depends on the position that the arm starts in. So it all starts with anatomy in terms of understanding muscle function. And just, I guess, one more thing on that, because I'm not going to go through every joint or muscle, is that there's you can kind of think of weight training programs generally as like a shotgun approach, because what people do when they go to the gym is they'll do a squat variation, a deadlift variation, a bench press, a row, etc. And that's all perfect. You actually don't need to know any anatomy at all to get good results. Okay. It's kind of like your shop bought barbecue sauce or like Dalmio pasta sauce. Let's say you go in, it's all pre-mixed, it's ready to go. It's going to satisfy most people. But there's going to be certain people that they'll taste the Dalmio sauce and they'll say, oh, a little bit too much acidity for me, or a little bit too much sweetness for me, or, oh, I can really, that there's a weird taste I'm getting off that personally. And that mightn't be the same for every single person. So if you were to be the expert, the chef, you probably wouldn't be making dalmio pasta sauce or putting that into your recipes. You'd probably be starting from scratch and playing around with different variables and understanding what the individual ingredients that go into it do, what sort of flavor profiles they contribute. And that's very similar to how a competent personal trainer thinks of an exercise program. They recognize that this client presenting to them, if they have no other issues, no significant training history, they're probably going to be fine on a basic program that they could get online. They'll probably get results from it, but they probably won't be their best results. And especially for that individual, as we analyze, let's say, the knee pain that they've struggled with in the past and their anatomical structure, their relative proportions. And, as you talk to them about exercise, what they have struggled with in the past in terms of technique, et cetera, you can come to a more specific program outcome for that person. That doesn't mean that every person requires a drastically different program, because many people will, follow a similar enough program at the beginning and get fine results, but there will always be outliers. There'll always be exceptions. And those are the people that having a solid understanding of anatomy can really help you to reach out to and help.
Yeah, 100%. And just going back there, because I just obviously showed a few images, like ultimately what you want to be able to do, and like I say, you're not going to go through every single muscle in the body, that would be excessive, but what you basically want to be able to do is go, here is, like, you see them all the time. You walk into a gym, usually they're held in some sort of assessment room or whatever. You have like an image of a human body. Usually they're really muscular, because obviously you want to accentuate the muscles, so we can actually visualize what's going on. But you want to be able to go, okay, that's the pec. What is the pec? Okay, that's the chest. Okay. And like I said, you're like, okay, there seems to be a few different things going on here with the chest, right? You need to be asking yourself, like, what movements actually target those different areas? Or what, you probably said a different way, like, what does that actually do? Okay, you see your chest. Now, in your head, you need to be able to go, okay, well, what does the chest actually do? Is it just, chest bench press? That's it, Because you think about that, it goes back to that kind of similar saying of, if all you have is a hammer, everything looks like a nail, right? So if all you know how to do, be like, okay, the only thing I know that works my chest is a bench press, right? And that's the extent of your knowledge. Like, obviously, you're not going to be able to modify your chest training, right? Because you only have a bench press to play with, right? And there's only so many like modifications you can make, maybe grip distance or grip width even, to change that. And obviously, yeah, that does do something, but you're still limited by just that exercise, right? So you want to learn anatomy to a basic level where you could look at an anatomy chart, again, a basic anatomy chart, and go, okay, that's the whatever muscle, right? And then you should be able to go, I know these exercises that target that muscle, right? That's the baseline. We need to be at that level, right? Now, ideally, we do go a little bit beyond that level and go, okay, this is why this would be a better exercise to target this muscle, right? Or this is why this would be a better exercise for me, or if you're a personal trainer, for other individuals to target this muscle, right? So we need to have that baseline where you're able to go, okay, I understand, the different muscles in the body. I can have a pretty, basic understanding of what this muscle does. Like if someone says, what does your lat do? You could be like, okay, this is what the lat does. And maybe you might not use words like, oh, I know how to use words like abduct or anything like that. You don't need to know the technical terms. You just need to be able to go, okay, well, if I want to work my lat, I need to, pull my arm down here or pull my arm back. You're like, okay, that's working my lat. And then you go, okay, well, what would change if I was to put my arm out to the side here? Does that change how my lat functions or how it works, right? You need to be able to just, explain those different things if you're trying to design up the best workout, and then also to be able to understand exercise much more cohesively. And again, you can go into the gym, like I said, and you can go, okay, I can get good results by just going in and doing the quote unquote basics that everyone has always done. Is like, oh, here's your bench press, just do your bench press if you want a bigger chest. And that's fine for a certain percentage of the population. That's going to work, right? You go in, you just exercise, you've no need to modify things or do anything at all. You just do whatever random program you found online, you go, cool, got results with that. But you would be able to get far better results likely, and then over time, ideally avoid injuries and stuff, or at least, somewhat prevent injuries by having a better understanding of anatomy, having a better understanding of how bodies actually move, beyond just oh, bicep does this, it's like, okay, well, we want to, dig a little bit deeper, right? And also like books like this is literally, I think my dad got this in fucking Lidl or Aldi or something like that. And it literally just goes through like, oh, here's all the different muscles that are worked in, different exercises. It's like, some of it's not necessarily all that accurate, but stuff like this can be really helpful for just visualizing like, oh, so those are the muscles that are active when I'm doing this exercise. And you might not think, oh, well, why are we starting at this anatomy level? Like, why are we, like we don't need to start here. But if you've ever been a personal trainer and you're actually talking to people in person, like you might be like, okay, we're going to do this exercise. And you might be thinking, oh, they're going to feel this in their hamstrings, for example, right? But the reality of the situation is like, I can't feel what you can feel. I can only feel what I can feel, right? That's the nature of humans, right? So when I'm doing an exercise, I might feel it, oh my God, wow, I'm actually getting a tremendous stretch on my hamstrings with this exercise, right? But someone else might be like, I literally only feel my low back on this exercise. Like something like an RDL, a Romanian deadlift, right? They might be like, no, I'm not getting this great stretch on my hamstrings here. All I'm feeling, if I try to go any deeper, I'm feeling this in my back, right? And a common one as well is like if you do some sort of like deadlift variation, you might have been told that, oh, this is a great exercise for your hamstrings, your glutes, and like your upper back, and maybe your grip as well, or something like that, right? And then you wake up the next morning, you're like, Jesus Christ, my low back feels like someone has just hit me with a fucking sledgehammer, right? And you might in your head be like, something's gone wrong now because they're not the muscles that we're supposed to be working. I shouldn't be feeling it there. I should be feeling it hamstrings, glutes, upper back, whatever, right? But if you were to actually understand, oh, well, these are the muscles that are involved in this exercise, that's why you're feeling it here, right? Then you have a much better understanding of, again, that exercise, and then also how to program that exercise effectively going forward, right? And then also how to modify exercises for you going forward, right? Like you might be like, I actually don't need to touch the barbell onto the ground to get the hip hinging benefits that I want. Maybe I can do a rack pull or an RDL or something like that, right? And rather than just a full deadlift. So understanding anatomy, just again, very basic anatomy, allows you to get better results, I would argue. And again, you don't have to start here. You can look at this as purely just exercises, choreography. You just need to learn off like how to squat, right? And if that is the case and you want to go down the route of just looking at it as choreography, then you still need to eventually come back to anatomy to be able to go like, okay, this is the ideal squat form or whatever exercise form. You're like, this is what it should theoretically look like, someone with perfect body proportions. Like say, for example, a squat, you want to see someone with these little short femurs, and it's like, oh, this perfectly upright high bar squat position, no limitation at the ankle, nothing, right? You want to be like, okay, that's how it's supposed to look. You're going to have a different squat presentation when you actually do it yourself. And then also, again, if you are a trainer yourself, you're going to see people squat differently. Maybe they have to put their legs a little bit wider. Maybe they tip forward a little bit and they're not quite over the center of their foot, and different things like that. If you don't understand anatomy from a basic level, you're not going to be able to modify that exercise. And while, yes, exercise to a large extent is actually quite intuitive, right? Like it's not that hard. Like you can feel your muscles working if you're doing it right. You can be like, oh, I actually feel it in this area. And then also you can visually see when something is off. You can be like, okay, well, actually you're tipping to your right side a little bit here or whatever. Like you can visually assess it, right? That's fine up until a point. And again, that'll get you quite far. But when you actually have some real modifying to do, like you're like, oh, actually, I'm not getting great results in my quads from this squat, if all you know is like, oh, well, the only thing I can modify here now is to do more or less of that exercise because you don't understand anatomy, you're like, you kind of just close yourself off from actual progress, right? And this is a lot of the times the problem with discussing exercise. The people that get great results from just doing the standard are usually the ones that have the loudest voices. They're just like, oh, we'll just squat to get bigger legs. And it's like, yeah, that's cool for you, who's like 5'8" and like perfectly built to squat. I'm like, the only thing that got bigger from me squatting, getting my squat to over 500 pounds was my ass, right? Because I'm 6'5" and I have fucking longest femurs in the world, right? And from an anatomy perspective, you would go, oh, well, clearly doing a squat like this, even a high bar squat for you, all it's going to build is your ass because of the way you're moving through space, right? So ultimately, the more you understand with anatomy, the better results you're likely going to be able to get, right? Would you agree with that statement, Gary?
Yeah, and you don't even have a big ass, so I don't know what happened.
See, this is the thing. I just stopped squatting because I don't want to have a big ass. It's just not attractive in men, at least.
Oh, it is. Oh, it is. Come on.
Look, whatever you're into, that's just, it's not for me,